I am Dr. Abdul Zahir, Assistant Professor, Department of Zoology. I am going to discuss an important topic, cancer. Cancer now causes the second largest number of death in most countries. A cancer is a tumor, abnormal growth of cells or uncontrolled growth of tissues. It has no useful purpose, but it is harmful as it grows. It is an autonomous growth, what we call the independent growth, follows its own laws. So first we have to know, how do cancers spread? When cancer is spread, it's called metastasis. In metastasis, cancer cells break away from where they first formed, travel through the blood vessels or lymph system, and form new tumors in other parts of the body. Cancer can spread through almost in anywhere in the body. It has commonly moves into bones, livers, or lungs. A tumor develops from control the tissues from the cells and anaplastic in nature. Anaplasia means reversion of differentiated cells into undifferentiated or embryonic cells. They have a greater potentiality for growth and multiplications. They carry out none of these functions of normal adult multiplications. Properties of cancer cells. The number of properties is there. Just I am going to highlight few important only. First one is contact inhibition. Contact inhibition means when cancer the nucleus of cancer cell is larger in size and irregular in shape, and then nucleolus is also larger in size and it exhibit hypertrophy. So most of the cancer cells are characterized by a chromosomal abnormality. This is due to normal mitosis. So centrioles involved in development of spindle fiber in division. Misbehavior of centrioles is another characteristic feature of cancer cells. So plasma membrane, cell membrane is leaky. Actually, the tumor cells contain tumor associated antigens on their cell membrane. In cell membrane of cancer cells, fibronectin, a component of cell adhesion, a glycoprotein is reduced, sometimes absent. Hence, cancer cell loss contact inhibition. And finally, growth promoting factor. The cancer cells produce an excessive amount of growth promoting factor. They escape by leaking through the cell membrane. After it has leaked out, it acts on the surface of neighboring cells. The result is a drastic increase in growth and multiplication of cells. The normal cells, which also become abnormal in shape. So here you can see the clear difference of normal cell and cancer cell division. So normal cell divide into a limited period and then stop dividing and undergoes differentiation. But cancer cell do not stop dividing and do not undergo differentiation. Tumor progression. So according to ICMR, Indian Council of Medical Research, estimate that there will be a 12% rise in cancer cases in India by next 5 years. The most common forms of cancer affecting the peoples of India are breast cancer, cervical cancer, and oral cancer. In men, cancer most likely to develop in the skin, lungs, stomach, intestine, mouth, etc. Whereas in women, the most common site are breast, uterus, intestine, stomach, and skin. The development of tumor is a progressive process involving several steps, of which 3 are evident. They are: the first step is a initiation. So initiation means the appearance of cancer where a normal cell begins to transform itself into a cancer cell. It is brought about by carcinogens, sometimes viruses, and heredity, or sometimes gene mutations. The second step, second phase, is called as promotion. During this stage, the change from dormancy to progressive growth occurs. The cells are stimulated to divide. Continuous tissue repairing, chronic irritation by presence of certain agents called carcinogens. Carcinogens means cancer-inducing agents. The last step is called progression. It is the final stage in the development of cancer. It leads to faster and more independent growth and loss contact inhibition. During this, the original nature of tissues become progressively lost. The plasma membrane leak out and enter blood vessels. They are carried by blood and are deposited into a nucleus. So, causes of cancer. Causes means actual reasons how the normal cells are affected. Okay. Chronic irritation caused to the tongue by broken or malformed teeth has often led to cancer of the tongue. Cancer of the lip was common when clay pipes were in use. And second causes, atmospheric pollution. So there are evidences to show that cancer easily affects city peoples than country peoples. It is true that the atmosphere over cities is often polluted with the products of combustion of coal and oil, with motor exhaust gases. The increase in industrialization has caused a corresponding increase in cancer cases. So heavy smoking causes an increase in number of lung cancer cases, but still no positive evidence that cigarette smoking alone causes lung cancer. Radiation like X-ray, cosmic rays, that irritated to normal cells. And some chemicals, substances added to food and medicine may have the effect of causing the development of cancer. Chemicals are more important than genetic factors in determining development of most cancer. All cancer is triggered by altered gene. So here the types of cancer on the basis of pain divided into 2 types. One is malignant tumor, grows pain, grows rapidly and spread other parts of the body. And second one is non-malignant tumor, otherwise called benign tumor, grows slow. They are restricted to place from in which they originate. So on the basis of tissues, the cancers are divided into a number of types. Carcinoma arising from epithelial cells such as skin lining membrane of internal organs. Sarcoma, malignant tumors arising from any connective tissues. Osteoma, tumors of bone. Fibroma arising from the fibrous tissues. Glioma develop in supporting connective tissues in the brain and central nervous system. Melanoma, skin cancer, it originates in certain types of pigmented mole found on the skin. Now it's rapidly growing pigmented tumors. Lymphoma developing on lymph node and other lymphatic systems. Teratoma arise from morula stage itself, inclusion of parasitic fetus. Cancer growths or injury that does not heal or that heals but reappears. Any continuous or repeated discharge or bleeding from any opening in the body, any lump or mass, whether an injury or not, that appears in a tissue, particularly a lump developing in the breast. Indigestion or any abnormal feeling in as alternating constipation and diarrhea, unexplainable loss of weight, persistent cough or sore throat. If a person has any one of these symptoms only once, there is no reason to alarm. However, if they continue or return, it is best to consult a qualified doctors. So diagnosis. First one is biopsy. It is a technique by which suspected cancer tissues can be tested. It consists of microscopic examination of a small portion of suspected tissues. And second one is X-ray, used to diagnose the cancers that affect the digestive tract, kidney and chest. Treatment. In olden days, diagnosis of cancer was equivalent to a sentence of death. But today's cancer can be cured. Almost all cancer start at some specific location in the body. But a few starts in more than one place. It is critical to detect cancer in its early stages before it penetrates nearby tissues or sends cells to other regions of the body. First one is surgery. In surgery, completely removing the cancerous growth. Radiations, radioactive substances, beam of radiations are focused on the tumor. The radiation kill cancer cells. In some cases, minute particles of radioactive substances are inserted directly into the cancerous tumor to kill the cancerous cell. Laser treatment. Injecting a reddish black drug, hematoporphyria derivatives. After 1 or 3 days, tumors are loaded with drugs, but most of the normal tissues are free from it. And a magic bullet. All the tumor cells have antigen on their surface. Antibodies are prepared against these antigen through by in vitro conditions. These antibodies are linked to toxins. For example, resin is a toxin for B lymphoma, lymph node of tumor cells. Even some evidences showed that few viruses responsible for causing cancer called oncovirus or tumor viruses. The main viruses associated with human cancers, they are human papilloma virus, the hepatitis B and hepatitis C viruses, the Epstein-Barr virus, etc. So experimental data suggests that the role for viruses and they appear to be the second most important risk factor for cancer development in human, exceeded only by tobacco usage. The mode of virally induced tumors can be divided into two. One is acutely transforming and second one is slowly transforming. In acutely transforming viruses, the viral particles carry a gene that encodes for an overactive oncogenes called viral oncogenes, and the infected cells is transformed as soon as oncogene is expressed. In contrast, in slowly transforming viruses, the virus genome is inserted. A viral genome is an essential part of retroviruses near a proto-oncogenes in the host genome. Slowly transforming viruses have a very long tumor inactivity compared to acutely transforming viruses. Hepatitis viruses, including hepatitis B and hepatitis C, can induce a chronic viral infections that leads to liver cancer. Worldwide, liver cancer is one of the most common and most deadly cancers due to a huge burden of viral hepatitis transmission and disease. Advances in cancer research, vaccines designed to prevent cancer have been created. The hepatitis B vaccine is the first vaccine that has been established to prevent liver cancer called hepatocellular carcinoma by preventing infection with the causative virus. In 2006, the US Food and Drug Administration approved a human papilloma virus vaccine called Gardasil. The vaccine protects against 4 HPV type, which together cause 70% of cervical cancers and 90% of genital warts. Here you can see the list of viruses and associated cancer types: hepatitis B virus, hepatitis C, etc. So oncogenes means a set of genes responsible for transformation of normal cell into tumor cells. Onco means is a Greek word called mass or tumor. Oncogenes are originally discovered in retrovirus called viral oncogenes. Oncogenes also found in human cells called cellular oncogenes. It is an viral origin but are cellular genes. These viruses pick up the oncogenes from animal cells by recombination during the course of infections. Though oncogenes are found in all human cells except RBC, because it is enucleated, majority of cells never become cancerous. Oncogenes have the potential of causing cancerous transformation of cells when appropriately activated. About 20 oncogenes have been discovered in viruses. When an RNA virus infects a cell, it becomes carcinogenic. The RNA virus replicates its RNA in host cells by producing DNA copies of its RNA. The virus's DNA is integrated into the host cell chromosome. Oncogenes are present in a section of integrated DNA. These integrated oncogenes are responsible of converting normal cell to cancerous one. The cellular oncogenes have essential role to play in cellular physiology, especially cell growth, cell division, or cell differentiation. So, what type of cancer can run in families because of genetics? Although cancer is common, only 5 to 10% of its heredity, meaning an individual has inherited an increased risk of cancer from one of their parents. This inherited risk of cancer is caused by a small change called as mutation in a gene, which can pass from one generation to next generation in a family. When someone inherits this type of gene mutation from a parent, hereditary cancers such as breast cancer, colon cancer, prostate cancer, ovarian cancer, uterine cancer, melanoma, a type of skin cancer, pancreatic cancers. So the hormones in relation to cancer are hormonal carcinogens, imbalance of sexual hormones. For example, estrogen, a group of female sex hormones, is known as human carcinogens. These hormones have essential physiological roles in both females and males. They have also been associated with an increased risk of certain cancers. Next, we are going to see that what are hormones dependent cancers. A hormone sensitive cancer is dependent on a hormone for growth and or survival. For example, breast cancer, which is dependent on estrogen like estradiol. Ovarian cancer, it can be affected by estrogen. A uterine or endometrial cancer, estrogen and progesterone can be fueled sometimes. Prostate cancer affected in the prostate gland of testis, which is dependent on androgens like testosterone. So finally, number of theories is there, scientist hypothesis or assumption is there, how the cancer is caused or origin of tumor, and how the normal cells are affected and caused tumor. Actually, cancer theory is a very big topic. Even some scientists says that during the early development of embryo, islets of cells may be misplaced and may become intermingled with other tissues. So sure, we will go to discuss in the next video. Thanks for your kind attention.